Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Thursday, February 18th. We are joined today by the Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Once again, our sign language interpretation is provided by Mary Thiessen, and André Boursier from French Language Services Directorate will provide French language translation. Following our speakers, we will go to reporters for questions. We'll begin with the reporters in the room and then go to the reporters on the phone lines. We'll call you by name and you will each have 2 questions. Before we begin, I'd like to verify that everyone can hear us. If any of the reporters are having a problem, please email eco@yukon.ca. Premier Silver?
And thank you everybody for joining us today. It's great to be here again with Mary and with Dr. Hanley and Andre and the team in the traditional territory of the Kwantlen First Nation and the Ta'anquatchin Council. Last week, 2 new cases of COVID-19 were identified and the public were notified of several possible exposure points. Both individuals are recovering at home. This is yet another reminder to all of us that even though we've done very well, COVID-19 has not gone away and is still a very real risk. It's important that we continue to take precautions so that we can minimize the risk of COVID-19 spread here in the territory. The best thing you can do to keep yourself and your fellow Yukoners safe, again, is to practice the Safe 6. Wash your hands often, maintain physical distancing, stay at home if you are sick, travel responsibly and respectfully, self-isolate as required, and follow the gathering guidelines that are in place, including limiting indoor gatherings to 10 people. Plus, remember, mask up in public. It will keep us all safe. Yukon's vaccine rollout is going very well. As of yesterday, 10,627 people received their first dose, and 917 people received their second dose. The mobile teams are continuing to travel through the communities and will be in Old Crow tomorrow and Beaver Creek and Watson Lake next week. I want to thank every single member of our mobile teams, mobile vaccination teams, Team Balto and Team Togo, for their work to immunize Yukon communities. And I want to also thank everyone in the communities who welcomed these mobile teams and who also took their shot when the team rolled into your town. I want to also thank the Team Fox. That is the team that is working here in Whitehorse. They have been administering second doses to those over 70 and 70 and over, and also to high-risk healthcare workers in Yukon. We received very good information about vaccine delivery last week. Our next shipment will include just over 16,000 doses of Moderna. These doses are tentatively expected to arrive on February 28th. If the vaccines arrive as scheduled, which we assume they will, we will be able to open up the Whitehorse Clinic to all eligible Yukoners as of March the 1st. The clinic will also be open this Monday for folks that are 65 years old and older. Appointments can be booked online at yukon.ca/thisisOurShot. Appointments for the first week of the general population clinic are also open. Please remember, you do need to book an appointment in order to get your vaccine. If you are not able to use the online booking system, then you can call 1-877-374-0425. Yukoners who are eligible for their second shot should know that it will be available roughly 4 to 6 weeks after your first dose. Do not be concerned if your appointment is not exactly 4 weeks after your first shot. There is a window of time where you safely and effectively can get your second dose. As Dr. Hanley has spoken to in previous updates, the second shot can create a stronger effect than the first one. This is good. This is that it's working. Those of you who have received your first shot can visit the booking website to make sure your appointment for the second one is there. We are now only days away from opening, as I said, the general population clinic to all eligible Yukoners. This is very good news for Yukon. We've been waiting a long time to get to this stage, and I know that getting immunized will come as a relief for many. I appreciate the commitment of the additional doses from the federal government. Last week, the last few weeks have involved some very intense negotiations, and we are now seeing the result of our work. While we continue to roll out immunizations to every Yukoner who is willing and able and eligible, we must do everything that we can do to keep our fellow Yukoners healthy and safe. We need to keep on practicing the Safe Six, keep on masking up, and most importantly, keep on looking after each other. So thank you, Yukoners, as we close up a year here of COVID. I'm very, very proud of the work that Yukoners have done to keep everybody safe. And we're seeing the light at the end of the tunnel, that's for sure. Thank you for all your diligence. Masi cho, ganashjish.
Thank you, Premier Silver. Dr. Hanley?
Thank you, Pat. Thank you, Premier Silver. Good morning, Momatau. It was only last week that I reflected that after a month with no cases, that things could change quickly. And the next day we announced the 2 new cases within the territory. Disappointing as it always is to hear, we knew that more cases were potentially on the horizon, and we were well prepared. As much as we may wish to continue COVID-free, that is just not the reality of COVID-19, and we will be living with COVID for a long time to come. The individual who was confirmed to have COVID-19 as of last Friday was working at an industrial worksite outside of territory, where unknowingly they contracted the virus. The individual was possibly infectious during travel back to the territory. And once in the territory, this person began the self-isolation process and shortly after became symptomatic. During that period, a household contact also became infected. These 2 new cases should not ring alarm bells, but they do remind us that we should always act as if someone around us could have COVID. Think about your own routines and behaviors and where you might be vulnerable to exposure. Choose a bubble and stick to it, and don't take risks by skimping on the safe 6+1. Yukon is always vulnerable to a certain degree, and we must keep that in mind before we put on a gathering or choose whether or not to wear a mask or go out for a night at the bar with our closest friends. I have here a few reflections on how we are doing overall, as the Premier said, closing in on a year through this pandemic. And we've remained quite steady with our case count, and we have thankfully been able to avoid what could have been much more turbulent times, as we've seen throughout other jurisdictions. We've been able to contain new cases quickly and effectively. Due to Yukon's existing strengths, our current capacity in public health management, a lot of long hours and tireless work, and perhaps a bit of luck, we have together managed to keep our case count low in comparison to other places. Pair our public health force with our dedicated and diligent healthcare professionals, as well as the public's receptivity to new legislation and guidelines, and we've been able so far to prevent our public health and acute care systems from getting overwhelmed. Once a Yukoner has been confirmed to have COVID-19 in the territory, they will be supported to keep their illness to themselves. They will help us identify others who may have been near them when they were infectious, and we will reach out to them to give them advice on how to stay healthy and protect others. All of this occurs without disclosing who the case is. We approach each new case proactively and carry out processes and measures that will contain further transmission in a confidential, supportive, and caring way. Accessible testing is also a huge part of the ongoing containment of cases. Testing is offered both in Whitehorse and all rural Yukon communities. Those who get tested are taking care of themselves and protecting others. Testing is critical in containing possible outbreaks and protects us all. Testing helps us understand where, when, how much disease is in Yukon, and supports the health and well-being of all. Support yourself and those you care about to get tested when they have symptoms, even mild ones. And lastly, it's Yukon's fortunate circumstances, as well as the steps that Yukoners have taken themselves, that have contributed to our current state. We're not regularly in a position of overcrowding, which reduces our risk. And when we're unable to maintain proper physical distancing, we are wearing masks. We are hardy advocates of spending time outdoors, which means a lower risk of transmission of COVID-19. And Yukoners' public adherence to mask use in public spaces, maintaining physical distancing where they can, staying home and away from others, when even a little bit ill, has been key to our success within this pandemic. But remember, when symptoms occur, do get the test. These key actions have kept us safe and will continue to be very important as we begin our fight against variants. It's this approach that has allowed us to control cases and maintain a strong level of control to limit the spread of COVID-19. The dedication of our public health teams and the investment made by Yukoners requires a huge thank you. So thank you, Yukoners, for all of your hard work as we continue to trend in the right direction due to your vigilance. As Canadians around the country anxiously watch the spread of COVID-19 variants, we are seeing that there are a number of new variants identified in recent weeks and months. At this time, it's difficult for us to answer how the introduction of variants may affect us as a territory. But as I've mentioned, we do know that it's something we need to be aware of and prepared to deal with. Current evidence supports that variants spread more easily, but there's no indication that the variants of concern are transmitted in fundamentally different modes from the standard versions of the virus. The basic pattern is also that they cause milder disease in most people, but still severe disease in some. With some variants, the numbers with severe disease may be more, but that still is not clearly evident. But it is more likely that those with mild disease will spread it around if they don't stay home and will go unrecognized if not tested. That is the more important metric because more infectious means more transmission, more cases, and thus the potential for more serious cases and deaths. Higher transmissibility suggests that for a given exposure there is a greater likelihood of infection, and hence there's less margin for error in our practices. The variants are not welcome visitors, but they are around, and we need to keep in mind that public health guidance may change as evidence evolves. Newfoundland offers a dramatic example of how quickly the new variants can spread. The introduction of variants into a population can, in just a matter of days, change everything. It's crucial that we remember it's never that far away from us. If we become even a little complacent, we are opening ourselves up to risk. And although we may be experiencing the lockdown blues, particularly in the middle of February, I do know that we are capable of keeping going. Let the returning light and the sunshine, the milder weather, the low case activity, and the incoming vaccine continue to help us push towards spring. If not, there is a chance that a variant introduction could quickly make itself known as it has in Newfoundland, who now, after a long period of low activity, have several hundred active cases in the province. One day or another, a variant will appear in Yukon. So back to what I said at the beginning. Act as if it is already here. Be ever mindful of safe practices, and we will be protected from variant spread just as well as we've kept this virus at bay over the last year. We must keep in mind that these little things, the safe 6+1, following COVID plans, keeping bubbles small, save lives, and keep us in good shape to make the most and enjoy what Yukon offers. Following the safe 6+1 is key, but our best long-term source of protection is getting the vaccine. And with a confirmed 16,000 doses set to arrive very soon, we're able to continue administering second doses alongside increasing our capacity to offer first doses. This shipment later this month will allow us to open the Whitehorse General Population Clinic as early as March 1st, as the Premier announced. In order to keep everything organized and streamlined, I ask that you please book your appointments. Walk-ins will not be able to be accommodated during these times, but will be asked to reschedule their appointments. As our teams have begun their journeys back into communities for the second round of immunization, I urge anyone in the communities who have not received their first dose, please step up on the second round to get your first dose. We all want to get back to a normal or near normal life, and that goal will be in reach if we take advantage of the opportunity to get vaccinated. So please, let's all do our part. Roll up our sleeves and take our shot. For those awaiting their second dose, thank you for your patience. I know many are anxious to receive their second dose promptly, and we will stick to that window of 28 to 42 days between receiving your first and second dose. The Premier mentioned side effects, and I know some people are worried about the side effects from the vaccine, especially the second dose. By the way, locally, we have had no significant or substantial reactions by anyone to the Moderna vaccine beyond some rashes, redness, muscle aches, and a few random symptoms. Globally, the data is showing us that the rate for serious allergic reactions is in the ballpark of 5 per million doses, a little lower than earlier estimates, and a figure which can offer us some comfort. As I mentioned last week, you may feel the second dose more than the first as your body responds to the boost to your immune system. For some of you, it may not be a pleasant experience and may feel as if you've had a bit of a 24-hour bug. You may wake up feeling slightly winded, a dull pain in the arm where you received your vaccine, maybe tired as well. This should be no cause for concern, but treat your symptoms as you would if you were dealing with a viral bug. Drink lots of fluids, rest, take over-the-counter pain medication if needed. About 5 to 10% of the time, you may get symptoms that are more severe, such as fever, body aches, and generally feeling unwell enough to just stay home. If this is the case, do so. Rest at home and take your time to get better. Stay home and away from others until your symptoms resolve. Remember also that COVID is also always a possibility. If you have cough or respiratory symptoms, that is not from the vaccine. Fever or body aches or fatigue that persist beyond the expected period of 1 or 2 days should also be taken seriously. Whenever symptoms are progressing or not going away, self-isolate, do the online self-assessment, or call 811 and check to see if you should be tested. If missing work, let your employer know that you have received your second dose and will not be able to come in until you feel your symptoms have resolved. Lastly, in Dr. Henry's recent update in BC, she reminded us that this is Random Acts of Kindness Week. So this week, be kind to someone when it may normally not even occur to you. Stretch your kindness just a little further. We all need it, and in harsh times we can still thrive when we just give a little bit more. And that's all for my update. Thank you. Remember to take care of each other. Stay well. Thank you, Masicho. Merci.
Thank you. We'll now go to questions, and we'll begin with the reporter in the room, Haley, Yukon News.
Thank you. One thing I heard from the federal update was that it was a number of provinces who'd had some of their Moderna doses contributed towards the northern allocation. Could you just speak to your knowledge of that and any message you have maybe for those provinces?
I think what happened was the federal government remembered their commitment to northern and indigenous remote communities. There was a conversation about what's fair with a slowdown of Moderna, and we worked diligently, both the chief medical officer working with their counterparts right across the nation, Minister Frost as well, and myself, reminding of the Prime Minister's commitment, which was to prioritize rural and indigenous and remote communities. And at the end of the day, Ottawa agreed that that was a commitment, and you're seeing the results of that.
Next question, Haley?
Yes, thank you. My other question was regarding the two active cases that we see right now. Are we expecting more cases connected to those two?
Yeah, thank you. It's too early to say, that we won't see more cases. I think it's encouraging that so far among the few contacts that we've had no development of symptoms. We are continuing to follow closely these contacts, and so far so good. We've had we've had people, of course, come forward because of the public notifications, but no test results positive from that. So I'd say we're looking pretty good, but there is a possibility in the next few days that we could have another case resulting.
Thank you. We'll move now to John, CKRW.
Hi, this is a question for either Premier Silver or Dr. Hanley, whoever's best to speak to it. In the February 12th case update, when case 71 and 72 were announced, there was a bit of a wording issue that caused a lot of confusion between people in various communities in regards to where case 72 came from, because it said linked to a previous case, but it wasn't explicitly stated that it was case 71. I guess, is the government going to try and work to improve communication methods after this little bit of back and forth confusion?
Yeah, the short answer is yes, and I realize now that the language was vague and a little confusing. And I want you to know, I think there are two principles that we're always trying to work with. One is that we want to get the notice out as quickly as possible, even as the information is evolving, because if we're going to do notification to the public and the possibility of public notifications, then the earlier the better. So sometimes we're doing it as the information that we are actually obtaining is evolving. So that's one principle. The second principle is, if I've said many times, is that we go to considerable lengths to protect identifiability of cases. So sometimes that affects how we language. And when the information is uncertain, we'll reveal what we can until we have a more clear picture of what's going on. So it's that rush to get information out while we're kind of managing what's coming into us. So the language was not intended to imply that case 72 is related to a previous case from a month ago. It was sort of deliberately ambiguous and in retrospect probably, as you said, confusing. So we will try to provide more clarity. But it is real that the connection between the two cases was not clear at the time that we were putting out the public notice.
Thank you. Next question, John?
Hi, this question's for Premier Silver. The Yukon Employees Union has come out disputing your claim from the last COVID update that 60% of continuing care staff across the facilities of Yukon were indeed off work, when you claimed that it was simply not true. I guess, what do you have to say to this? That you were fact-checked and you were wrong?
I made my comments based upon the comments that I heard that morning from the union, and I stated my comments.
Thank you. We'll move now to Philippe, CBC Yukon.
Yes, thank you. I want to ask about the decision to open up a clinic to the general public and not prioritize beyond that. So my personal example, I can work from home. I'm lucky that way. But if I call, am I taking a dose from maybe someone like a teacher or someone who works at a grocery store who's in more contact and needs it more? Why not prioritize the general clinic so that people like public workers, police officers get first priority?
Really good question, and I think Dr. Hanley has handled it a couple of times now, a couple of different weeks of having that question. Yukon is in an excellent situation where we don't have to go too far down a rabbit hole of prioritizing groups of our population because we are opening up a general clinic. So if you want a vaccine, you can book an appointment for that vaccine. If we were going to prioritize other groups, then it would be a prioritization of days and weeks as opposed to what the rest of Canada is witnessing, which would be months. We believe that the most effective way to get the most amount of vaccines out the door is to open up that clinic. We made the argument to Ottawa as well that we can vaccinate up to 1,000 people a day, and opening up to a general population allows us to expedite that process. So I think, after careful consideration of the situations, Dr. Hanley has talked about our elderly population being the ones that are more at risk, and we've effectively vaccinated folks that are over 70 and then into 65 this week. And we believe that opening up that general clinic and getting these vaccines out and continuing with the second doses into the rural communities as well, we are effectively using our vaccination supply as effectively as possible.
Hanley?
Yeah, of course, I completely agree because, as the Premier said, I've spoken to this numerous times. But it is a really good question, Philip, and I would also invite you, to if you know that your neighbor or someone that that has, say, more medical conditions or has other reasons, you can book a little later. And I think the advantage of this mass booking approach is it gives people that kind of discretion. We are going to get this all done within a matter of weeks, and by spreading out that booking, it allows people to choose a time that really works well for them without everyone having to go into those grouped layers. So I actually think we have been working hard to take care of the key priority groups by age, largely by age, but also vulnerable populations and our rural communities. So those were all of those kind of stage one priority groups we have already taken care of as our initial supplies have come in. And now that the taps are going to be open, the best way, and this is from our experience with flu clinics and over the years, the best way to handle a number of different priority groups at the same time is to open up the booking. We can do several hundred up to 1,000 on some days immunizations per day and let people choose the time that works for them.
Thank you. Next question, Philippe?
Yes, thank you very much. Quick detail, I wonder if you could tell us about the contribution that pharmacists are playing in this process, because I understand you've recruited pharmacists to help out.
Yeah, I can speak to that. Pharmacists have been among the immunizers that have stepped forward. There have been a number of other groups, whether people that have been retired or people working in other healthcare areas, and we're really pleased to be working with the pharmacists. Of course, whereas the flu vaccine can be offered on site at pharmacies, that's not the case with the Moderna. So it's more a matter of the pharmacists joining the immunizing teams and using their skills, and they've gone through all of course the training that all the immunizers have done, extensive training around general immunization, but also around the particular and unique characteristics of the Moderna vaccine. So we're very pleased to be working with our pharmacist colleagues.
Thank you. We'll move to Tim, Whitehorse Star.
Yes, thank you. My question is first for the Premier. CBC had a report in earlier this week about the government doing sampling of wastewater, apparently looking for COVID. A staff reporter from the Star asked about this last fall and was ignored. So would you care to explain what the government is looking for in these wastewater samples?
I don't know anything about your staff reporter being ignored, but I believe this is really more of a question for Dr. Hanley as far as why now and the importance of this study.
Yeah, thanks for that. So, wastewater surveillance, as you may know, is really an emerging area which is being researched and piloted in different sites around the country. And we know our colleagues in Northwest Territories, for example, are adding that to their surveillance basket. The city of Ottawa has used it, and other sites. So what happened was with us was just looking into some of the operational feasibilities, like how would it actually work if we were to take that on? What type of sampling? How would it get to the laboratory? What would the turnaround time look like? And really just kind of working through with environmental health officers what it would take. And at the same time, of course, we've been, from a strategic point of view, looking at where wastewater surveillance might rank in our priorities. Right now, we're not pursuing further wastewater surveillance. We've done some of that baseline feasibility study. We've put that project on hold, but we may visit it later. Yeah, right now, we're focused on some other priorities around testing. We, as always, have a multi-pronged approach to our overall strategy, as I alluded to in my speaking notes, but also particularly on testing. So really, it's always looking where are the potential risks and where should we be focusing our either our communications or our surveillance activities. So right now, wastewater is not high on our list, but I'm really pleased that we've done some of this initial feasibility work, so that it's kind of it's in the cards, but it's not up next.
Thank you. Do you have a second question, Tim?
Yes, I had someone email me the other day talking about the traveling orthodontists that come up here to the Yukon from BC. And apparently they're not a priority group to be vaccinated, even though they're working with the kids here in a rather up close and personal fashion. And I'm sure there's other traveling medical professionals that this applies to. Why are these people not being prioritized for being vaccinated?
Yeah, I'm not aware of that actual email, but we are always looking at both our ongoing prioritizations, as I just discussed, through our first stage of vaccination, and now into the wider focus. And meanwhile, we have been addressing individual exemptions where there's compelling need to get an early vaccine, and many of these have been people who have been going out for medical travel, for example, and the timing just affects their ability to get the vaccine at the normal time, or they are at particular risk. So we will be addressing visiting specialists. They haven't been in the first tier, you might say, of the priority groups, because we are really comfortable and confident about the procedures that are in place for dentists and our visiting dental specialists. So where really, we've been working for months with our visiting orthodontists, other specialists, to ensure that screening processes and operational procedures are COVID safe. And that gives us the confidence that we don't, we're not dealing in the upcoming weeks with limited supply, but we have been dealing with some of these first tier priority groups, such as the ones we've just discussed, those who are older age, those who are in vulnerable congregate living circumstances, and then some of these individual circumstances where there's people on chemotherapy or traveling out for medical care that are potentially at higher risk of exposure.
Thank you. On va passer maintenant à Marine, à Roboréal.
Oui, merci. Docteur Hanley, est-ce que vous pouvez confirmer que les 2 cas que nous avons eu la semaine passée ne sont pas des nouvelles variantes?
Dr. Hanley, can you confirm that the 2 new cases that we got last week are not cases of variants of COVID-19?
Oui, on a en fait demandé des dépistages pour vérifier qu'ils ne sont pas des variants, mais on n'a pas cette information toujours. Mais on attend dans les prochaines quelques jours d'avoir un résultat. J'ai pas une très haute suspicion de variante basée sur la région où d'où l'importation de virus est venue. Donc, c'était pas un endroit où on a vu des variants. Donc, je pense que c'est pas une autre suspicion, mais c'est possible et c'est pour ça qu'on a demandé la dépistage. Donc, plus d'informations à venir. I will just answer that in English as well. The question was whether the cases might be due to a variant. We have actually asked for screening in BC for the variant. There is a screening process through the PCR testing, which looks for certain genes, gene markers of variant. So we have actually asked for that for these cases, but we don't have that information. I will say, though, that I'm not highly suspicious that these are variants, just because of the area of importation where the exposure happened is not an area where there are variants known to circulate. So it is a possibility, but I'd say it's a low possibility, and we will know in the days to come.
Avez-vous une autre question, Marine?
Oui, merci. Le vaccin Moderna est-il toujours considéré comme une bonne protection contre les nouvelles variantes aussi?
So is the Moderna vaccine still considered a good vaccine against the variants of the virus?
Oui, une bonne question. Jusqu'au maintenant, oui, on a des bonnes nouvelles. L'évidence est que, particulièrement pour le variant 117, appelé comme le variant anglais, on peut dire, du Royaume-Uni. C'est le Moderna. Les études démontrent que le Moderna protège contre cette variante aussi. Celle d'origine de Sud-Africain est protective. Donc, au même temps, la compagnie Moderna est en train de développer des nouvelles vaccins pour le futur qui peuvent assurer l'immunité ou la protection contre les variants. Donc c'est toujours un jeu entre les nouvelles variantes et les modifications de vaccins, mais surtout avec le Moderna et les Pfizer vaccins, on a les moyens avec la production de changer le vaccin selon les changements de virus. Donc c'est toujours on peut attendre cette jeu.
Could I ask you to repeat that in English, please?
So far the evidence is quite promising for protection of Moderna against the variants, particularly the UK variant, which is the predominant circulating variant in Canada, and also it looks promising against South African variants. We could in the future see more other variants that are more vaccine resistant. At the same time, I was describing it as a kind of a game between the vaccine and the variants. These messenger RNA vaccines, the Moderna and the Pfizer vaccines, they do lend themselves to modification. So the vaccines can actually be modified to match other variants. So it's possible that Moderna booster shots down the line could be modified to better match the variants. But for right now, the evidence shows us that for the common variants, the vaccine appears to be protective.
Thank you. We'll move to Chris, CBC.
Hi, thanks. So I wanted to follow up on Tim's first question about wastewater testing. And I just wonder if Dr. Hanley could offer a little more detail about what was actually found during those baseline tests and explain why Yukon wouldn't continue with wastewater testing given that the NWT has actually found positive cases that way.
Yeah. So again, like I said, this is more on the operational side, to looking as how it would work. Were we to do this, how would it work? So, for example, do you do a continuous sampling or grab sampling? So, continuous sampling is something that's carried out in where the infrastructure exists in the large cities. If you do grab sampling, which means actually physically taking a sample, you have to be very cognizant of where you're taking that sample from and how representative that sample is of the actual drainage area, you might say, of where you're taking it, and then how would you apply that rurally, or how would you apply it to the city as a whole? What parts are you going to miss, and what time are you going to take it, and how does that match the time of when you're going to have the optimal time to catch COVID if it's around. So there are, as with anything, it requires significant investment. It requires significant resources. It's going to have the potential for false negatives. Although it could have, it's less likely to be a question of false positives. It may be redundant to information that we'd already have from the way that we have people in isolation, the way that we follow up on people, and the way that we test people when they're contacts. So it's really, what is the added value given all of the other layers that we already have in place, and there has to be a prioritization, because if you are going to invest in wastewater, what else are you going to put aside in your priorities? So it really comes to where does it fit, and what's the added value. It's I'm really happy that it's working well for NWT. They have a number of other considerations. They have these kind of several kind of large rural centers dispersed around NWT, that we have very different, I think, demographic and geographic considerations, and we've developed different approaches just naturally from being different jurisdictions. So I think it's very hard to really directly compare us to NWT. I would just say that for us, we've looked at it. We think it does have possibilities down the line. It might be a long-term mechanism for adding to our surveillance capacity, but for right now, it's not our biggest priority.
Thank you. Do you have another question, Chris?
Yeah, my second question is about rural vaccination. I know you've been encouraging people to get their first shot if they missed the first pass. Can you give us an updated percentage on vaccine update in the communities?
I don't have it on me, so.
Yeah, I can give you an overall percentage where we, so far, we're just over 50%. So 53% was the overall coverage. And then there is some variability. Now, the minister has been talking individually with each of the communities. So at this point, because where the minister is in these individual discussions, we're not releasing results by community. And that really becomes then a decision of the communities and the leadership in the communities. There are a number of caveats, and I think one of the things that when I was talking with the chiefs yesterday, I pointed out was the fantastic participation that we've had and support that we've had from our First Nations, our First Nation partners in organizing the community responses and the participation. And we've really seen great leadership and organizational capacity. The CYFN team have also been excellent in helping with our communications and approach. And we do know that what we've also been able to learn is that what worked well in one community can be shared with other communities where they've had more challenges. So something as simple as organizing transport, for example, and how that's done can make quite a difference in the people's just increasing that accessibility, of course. Might make the difference in a few more people being able to get their vaccine. So we're translating many of these learnings into this next time round, where people will have the opportunity again to come forward for their first dose. So I'm really really pleased with the progress so far, and with the willingness and the organization that has been demonstrated in the first round, and really looking forward to the next results. And I think over the weeks and months ahead, we're going to get at or potentially beyond our 75% goal.
Premier Silver?
I'll just add very, very quickly a positive shout out to the community of Watson Lake. You know, Watson Lake being the first major rural community to be a general population clinic, and they did, the medical community there, chief and council, mayor and council, all leaders in that community really stepped up to be one of the first communities in North America really to go to general population. And not only the days that the mobile clinics were there, but since then, the communication, the continuous communication and partnership, and making sure that people have the most up-to-date information, it continues on in these communities. And so, Watson Lake being the first, every community did so fantastic. They really did. But just a little extra credit to Watson Lake for being the first of a major communities to really step up. So thank you.
Thank you. Et maintenant, Claudiane, Radio-Canada.
Yes, I'll just pursue, since that was a question I had as well last week. So you've just talked about Watson Lake. So two numbers that I'd like confirmed. So I heard 50%. Is that the uptake for communities? If you could confirm that number. And since you spoke about Watson Lake, can you give us an idea of when those numbers will come out per community? Which community was made perhaps more enthusiastic, or?
Yeah, I think Dr. Hanley covered that in the last question. Basically, the average amongst all the rural communities being over 50%, and for the first round, and that's very, very positive. Minister Frost is talking individually to chief and councils. I know that Minister Stryker is talking to mayor and councils about more specific numbers with leadership in those communities. Those communities have been so. The mayors and councils and chief and councils in each community have been absolutely amazing partners, and so as far as specific details for specific communities, we'll leave that up to the specific communities. It comes down to everybody having the most up-to-date information in leadership, and then deciding how that's going to, how they are going to pivot to reach parts of the community that might not have got all the updated information, or how can we better meet people where they are and augment and continue to specialize our mobile clinic teams. Talking to the two mobile teams, I don't think there's been a specific community that they've gone to that they didn't go. Now that we're finished our first round, we have some great new improvements that we will look at in the second time. And every time that they do that, they'll increase participation. Every time that another day goes forward where you see another person, maybe a relative, maybe a friend, maybe somebody in another community that you trust or respect, that is saying, I got my shot and this is the reason that I got my shot. These are the things we're really concentrating on to make sure that people step up. Again, this is our time, this is our shot, to make sure that they get immunized and get the most up-to-date information. That's the really important thing. Sharing the individual stats of individual communities, we'll leave that up to the leadership in those communities.
Thank you. Next question, Claudiane?
So some people are wondering why some appointments are left blank, why there isn't more effort in trying to fill those blanked appointments in the schedule. And I'm wondering, once the general public opens up March 1st, if there will be efforts to make sure that all of the spots are filled, and if you think there will be perhaps a more popular uptake than the 50% of the communities in the community.
Really good question, Claudienne. It's all about distribution. It's all about knowing when the all of our vaccines and the amounts of vaccines land in the Yukon. What the medical community here, what the mobile teams, Dr. Hanley and his team, and Pauline Frost and Stephen Samus and their teams, they make sure that we have enough second doses when we put first doses in arms. So if there was in the past some, as you say, gaps in the schedule, we effectively are getting the vaccines out as efficiently as possible, knowing full well that our bookings are limited to the storage of second vaccinations. Other jurisdictions have not gone in this direction. We have, and I completely trust the recommendations from Dr. Hanley and his team. This is the best way for us to immunize, especially when we've been prioritized as rural, northern, and indigenous. So if there was days where the clinics were slower than other days, it's again based upon our supply and most importantly, the supply of that second vaccination. We're not going to put vaccination 1 into your arm without knowing that your second vaccination is either here or we already know the specifics of the shipment through FedEx into the territory.
Thank you. I'd like to thank everyone for their time today. The next COVID-19 update will take place on Thursday, February 25th at 9:30 a.m.